A lower segment cesarean section, LSCS, also known as a C-section, is a surgical procedure performed to deliver a baby through an incision made in the mother's abdomen and uterus. This procedure is usually done when a vaginal delivery is not considered safe or feasible for various medical reasons. Here's an overview of the typical procedure for LSCS. Preparation. 1. Medical assessment. The decision for a LSCS is usually made based on medical indications such as previous C-sections, breech presentation, placenta previa, fetal distress, cephalopelvic disproportion, or certain maternal medical conditions. 2. Consent. The patient is informed about the procedure, its risks, benefits, and alternatives. 2. Once the patient consents, the procedure can proceed. Before surgery. 1. Fasting. The patient is typically required to fast for a certain period before the surgery to minimize the risk of aspiration, inhaling stomach contents into the lungs. 2. IV line. An intravenous, IV, line is inserted into the patient's arm to administer fluids and medications. 3. Anesthesia. Anesthesia options include regional anesthesia, spinal or epidural, or general anesthesia. 3. Regional anesthesia is more common, as it allows the patient to remain awake while numbing the lower half of the body. During surgery. 1. Positioning. The patient is positioned on the operating table, usually lying on her back with her arms stretched out. 2. Prepping and draping. The surgical site, abdomen, is cleaned and sterilized. 2. Sterile drapes are placed to create a sterile field around the surgical area. 3. Incision. A horizontal incision is made just above the pubic hairline, bikini incision, or a vertical incision may be used in some cases. 3. The incision cuts through the skin, subcutaneous tissue, and the underlying fascia. 4. Access to uterus. The surgeon then carefully makes an incision in the uterus. 4. The type of uterine incision can vary, usually a low transverse incision, but sometimes a vertical incision, depending on factors such as previous C-sections, the position of the baby, and other medical considerations. 5. Delivery of baby. The baby is gently delivered through the uterine incision. 5. The amniotic fluid is suctioned from the baby's nose and mouth, and the umbilical cord is clamped and cut. 6. Placental removal. The placenta is carefully detached from the uterine wall and removed. 7. Uterine closure. The uterine incision is closed using sutures or staples, depending on the surgeon's preference. 8. Abdominal closure. The abdominal incision is closed using layers of sutures or surgical staples. After surgery. 1. Recovery. The patient is moved to a recovery area where she is closely monitored as she wakes up from anesthesia. 2. Pain management. Pain relief medication is administered as needed. 3. Postoperative care. The patient's vital signs, incision site, and overall recovery are monitored. 4. Hospital stay. The length of hospital stay varies, but it's typically a few days, depending on the patient's condition and the type of delivery. 5. Mobility. Early mobilization and gentle walking are encouraged to promote healing and prevent blood clots. 6. Follow-up. The patient will have postoperative appointments to monitor the incision's healing and overall recovery.